Perfect. Thank you, Mr. Desouter, for joining us today for our coverage of the EASD. We had a very interesting talk just now about fasting proinsulin and the C-Peptid-Ratio as minimally invasive alternative to predict development of stage 3 type 1 diabetes. Could you just summarize your talk for us? That'd be nice.
Yes, thank you. So screening is really gaining momentum, but we also need to be able to monitor these individuals to be able to prevent diabetic ketoacidosis and to enable a softer landing, earlier start of insulin, and also early interventions with disease-modifying drugs. And we usually do this with repeated oral glucose tolerance tests, or another alternative is CGM, but it won't be for everyone. And we need minimally invasive alternatives that are also cost efficient. So that's why we looked into the fasting proinsulin over C-Peptid-Ratio. And we did a longitudinal data analysis to compare its predictive performance for developing clinical onset of type 1 diabetes. And we found that it was a good predictor, and it also complemented HbA1c, which is also an easy, cheap marker for predicting progression. And in a model where we combined CGM with the fasting proinsulin over C-Peptid-Ratio adjusted for insulin resistance and HbA1c, actually our model was as informative as stimulated OGTT variables and HbA1c. So that was really exciting.
Yeah, very exciting research. And what do you think? What has to be done so that this C-peptide proinsulin indices can be used for diagnostic purpose?
Yeah, I think we need to validate it in more diverse and also longitudinal cohorts, because we won't just do one single monitoring visit. We will see them again and again and again. So longitudinal data analysis is very important. And then we also have to define generalizable cutoffs to say if it's that high, this is the risk. So we can actually use it in clinical practice. And I think when really considering for use in population screening, we need to determine how acceptable it is it cost efficient, and how frequent should we do it? And these are really important questions for monitoring in pre-symptomatic type 1.
Yes. And what do you think, how could your research influence the treatment and future of diabetes type 1?
So I hope we'll be able to better define who will respond well to certain disease-modifying drugs and who actually won't benefit from it, so we don't have to expose them to potential side effects or heavy treatment protocols. So I think it would be very interesting, and there's also some preliminary data on that to see if we can use it to identify good responders to disease-modifying drugs.
Perfect. Very nice. Thank you very much, and have a nice conference.
Thank you so much. And you too.